New technologies for the early detection of breast cancer have improved outcomes and have led to better quality lives for these patients. We spoke with Dr. Frank Rodriguez at Lee Memorial Health System's Regional Cancer Center about how breast cancer care is changing and the importance of screening.
There's a lot of controversy in terms of when screening should begin. The younger the woman is, the denser the breast is, and the less likely it is that you can actually find something, even if there's something within the breast. Okay? Some people recommend getting a baseline mammogram at the age of 35. Other people recommend baseline mammogram at the age of 40. And that's sort of your starting point. And then after that, getting yearly mammograms after the age of either 40 or 50. I personally feel that doing a baseline mammogram at the age of 35 and then starting yearly mammograms after the age of 40 is appropriate. If your mother was diagnosed with breast cancer at the age of 35, then you want to be screened at the age of 25. So 10 years before your first degree relatives or your close relatives were diagnosed.
The stage of the breast cancer is a major factor in the kinds of treatment.
Treatments are highly variable. It depends on the stage of the disease, the condition that the woman or man is in at the time. But for the most part, the first step after the diagnosis of breast cancer has been made is to do a surgical resection or a small surgery to take the cancer out. Once we do that, we know what other treatments are going to be necessary. Some people may need just hormonal therapy, which is usually in the form of pills. Other people may need chemotherapy, and other people may need radiation therapy. So it just depends on the extent of the disease and how healthy the woman is otherwise.
Due to breast cancer awareness campaigns, there have been dramatic improvements in diagnosis and treatment.
I think it's important to say when you speak about the advances in breast cancer that patients and their advocates out there have done a tremendous job in pushing for research. That's the reason that breast cancer has changed as dramatically as it has over the past few years. So all those pink ribbon out there, all those walks that women are doing, they're making a difference. So it's important to continue that effort. In terms of specific improvements, in terms of diagnosis, our mammography technology has changed dramatically. All mammograms, or most of the mammograms now, are in digital format, so it's actually much more precise and they can be evaluated in a bunch of different ways, whereas films could not be. So diagnosis is changing. In terms of your surgical approach, we're leaning towards less is more. So doing a lumpectomy as opposed to a mastectomy, where you remove the tumor only, also appears to be a very effective option. In terms of chemotherapy, there have been tremendous advances in both the type of drugs we give, the efficacy, and the way we manage their side effects. And there are new radiation techniques that minimize the exposure to healthy tissue while focusing that energy to the area of concern.
There have been great advancements, but there is more to do.
There is clearly a lot of work to be done in beating this disease. Patients with early stage breast cancer, those that present with a lump in their breast, are for the most part going to have an overwhelming chance of being cured. Women who now present with disease that has spread to other areas, for example the bone, okay, those women we're still struggling with in terms of providing them the best possible chance of long-term benefit. We can't cure those yet, but we are certainly working as hard as we can to come up with new treatments and new diagnostic modalities to maximize our chances of winning this war.
For more information about Dr. Rodriguez or Lee Memorial Health System's Regional Cancer Center, call 239-454-8725 or visit leememorial.org.